My dear doctor friends, I'm going to talk today on how not to lose a patient to follow up. Sounds like a marketing phenomena? Definitely not, because medical practice is not about marketing. It's basically about connection. It's basically about relationship. Yes, most importantly, it is about good diagnosis and good treatment. But then, why do we lose patients to follow up? We have a couple of new cases coming to us, and why they don't come back to us after 2 weeks or 3 weeks? Why do these patients go to some other doctors? Well, going to other doctors is fine, so long as they feel better. But why should we lose a patient, especially if they are dissatisfied? It comes down ultimately to how is your relationship management, friends. I reiterate, primarily is about good treatment, your knowledge, your medical acumen, your clinical skills, your prescription, your follow-up criteria, your investigations. But apart from these, there are many things which make a good doctor. And these are all the skills we must learn. Friends, primarily, when a patient comes to you, greet them with a smile. Never indulge in some other activities like phone or email or Facebook when you are with a patient. We feel sometimes that the patient is not understanding. Sometimes we have that ego and we feel that we are doing a favor by seeing patients. It is not so. Try to understand that when a patient is unwell, he thinks of nothing but his health. How would you feel if your mother is unwell and you go to a doctor and he is not giving you attention? Friends, it's ultimately about attention. Medical practice is 99% of empathy, sympathy, and 1% of medication. We see so many times if a doctor talks well with a patient, gives him time, gives him genuine time and takes interest in the patient, they will come back. Even if the complaint doesn't improve, he will still come back to you and say that, well, me feeling better is destiny, but doctor has taken a lot of efforts. Friends, walk that extra mile to make a patient feel comfortable. My teacher, the great corporate guru Sunil Agarwal, says that when you go to a chai wala, along with the chai you get a cutting, along with the cutting you get even some water. When you go to a pan wala, he'll ask you questions that bade saab kaise hain, bhabhi ji kaise hain, bacche kaise hain, gaon kabhi gaye the, sab theek hai ghar mein. Now all these things make huge difference, friends. It's not about a 5-star. You may go to 5-star and you may come back with the experience that you've not been taken care of. And as said, you may go to a pan wala and you feel that, wow, it was a terrific experience. I've just paid 10 rupees. Friends, it's about a total experience which one gathers when one goes to a doctor. That experience, if you want to give a patient, then you have to think how the patient thinks. You must have that sensitivity that yes, I must give time to the patient. I must examine him properly. I will not do haphazard work. I will not just merely look at the reports. Patients do understand, friends. Patients are Googling out everything. And even if they are educated or even if they are not educated, the language of love is understood everywhere. Give them smile. Talk to them. Ask them questions. And I tell you, the whole relationship changes. Many times we are not in the position of managing these patients. We may refer them to other doctors. So instead of giving them a note, why can't we call up our doctor colleagues and take an appointment for them? These small things, that extra mile traveled, will help us in a big way in maintaining and developing relationship with the patient. Our job today is about healing people, healing minds. And I think we can do a big healing by talking and communication. Let us extend our hands for communication. Let us not run after money. Let us not just think in short-term way, but also think in long-term. I tell you, if all doctors have this sensitivity, then their practice is bound to increase. I'm about to take a very big lecture on this patient-doctor relationship and this association, and how do we develop this association symbiotically to help patient to feel better and to heal themselves. This lecture also will be put up on YouTube soon. I'm sure you'll like it. Thank you. All the best. Be sensitive.